8 years ago, I came to the United Kingdom to study medicine, and I decided to stay here, even though I can make 4 times as much back home in the United States as an A&E doctor. But I decided to stay here working here because I love the NHS so much. And I love it because I've seen what healthcare is like in a privatized American system where, 30 million people have no health insurance at all, where 50 million people have, a terrible insurance, where we have to, as clinicians, argue with insurance companies about patients' care while they deny access, or we have to ask for credit cards, before treating them, or patients, when they're seriously injured, they say, please don't call an ambulance because they can't afford it. That's terrible. That's barbaric. It's not the way that, healthcare should be delivered, especially in the wealthiest country on the planet. And so when I came to the United Kingdom and I learned that 10 years ago, you guys had the #1 ranked healthcare system on the planet, I was floored. I thought that was so freaking cool that you guys had the #1 ranked, the most well-respected, delivering the best care for the best price anywhere around the globe. It was an incredible achievement. And then in the last 8 years, I've seen standards, fall to such a significant degree here. And it is so heartbreaking that we have this massive crisis now for both staff and patients, where patients are suffering on the longest waiting list in NHS history. It's 7.4 million people long. It's taking forever for patients to see their GPs, to be seen in A&E, to get their cancer referrals. This is the 6th wealthiest country on the planet. This is unacceptable. And, what you've seen is a government that does not care about NHS staff, doesn't care about NHS patients. They don't care that we've lost 32% of our pay in the last 15 years. They don't care that staff suicides are at record highs right now. It is becoming unbearable to work in the NHS, and it's driving staff out of the system to go work in Australia, to go work in New Zealand. And that is hurting patients, and that is hurting staff. And, it's just the horrors that we see right now for patients is unacceptable. And that is why so many of us have been driven to strike, because we need a change in the system. We need a government that cares about you and cares about us. And the only way we're going to get there is to fight together for it. So please join us in the picket line. Let's fight together for a better NHS. We can do it.